Bowel cancer is an abnormal growth of the inner lining of the large bowel. Bowel cancer, or colorectal cancer as it's often called, usually starts as a small, harmless and benign polyp, which slowly grows over a period of years before it turns into cancer. During this period, and even when the polyp turns into cancer early on, patients do not experience symptoms. Perhaps the first symptom that patients may notice, which often they may ignore, is rectal bleeding or bleeding from the back passage. So if you develop bleeding, you mustn't panic, but because the commonest cause of bleeding is piles. However, it is important you report the bleeding to your doctor. The problem with bowel cancer is that by the time patients develop symptoms, the cancer has become well established. So symptoms of bowel cancer include an unexplained and persistent change in the way you open your bowels towards loose stools, an unexplained or persistent abdominal pain or weight loss, anemia, or an abdominal swelling. Again, if you develop any of these swellings, any of these symptoms, it doesn't mean that you've got cancer, as the risk of cancer with these symptoms is in the order of 3 to 10, perhaps 15%, depending on what symptom and the combination of symptoms you have. However, the issue here with bowel cancer is about early diagnosis. So the earlier you present to your doctor with your symptoms, the earlier we detect the cancer and the more likely we are able to cure it for you. So therefore, it is important when you develop these symptoms that you go and see your doctor so that they can advise you whether this should be investigated or not. Bowel cancer is the fourth commonest cancer in the UK. About 41,000 patients develop the disease each year. It accounts for about 12% of all cancers diagnosed. About 1 in 14 men and 1 in 19 women will experience or will develop bowel cancer during their lifetime. Bowel cancer can spread if not detected and treated early. So the cancer usually spreads to the liver or lungs or other abdominal organs, usually by sending cancer cells via the bloodstream. Also, cancer can spread locally by growing outwards outside the bowel and invading the nearby organs. It can also grow inside the bowel, causing narrowing of the bowel lumen, which leads to blockage. Blockage is a situation whereby you stop opening your bowels, you stop passing flatus, your abdomen becomes distended and painful, and you may vomit. Unfortunately, a quarter of patients with bowel cancer present as an emergency, which means that cancer is usually advanced and the outcomes is not as good as when the cancer is detected early. Again, this is why it is important when you develop symptoms, you must report them to your doctor as early as possible. Bowel cancer can be totally prevented. And when we talk about prevention, we talk about primary or secondary prevention. So what do we mean by primary prevention? Well, this is preventing the disease or the cancer before it develops. That is at the polyp stage, in other words, before the polyp even develops. For primary prevention, we rely on patients' lifestyle, for example, leading an active life or exercising regularly, has been shown to reduce the risk of bowel cancer by up to 50%. Similarly, eating food that is low in fat and rich in fruits and vegetables can also reduce the risk of bowel cancer by up to 50%. The role of drugs, medicines, which we call in the medical world chemoprevention, is really unclear. There are reports that suggest using aspirin or certain non-steroidal anti-inflammatory drugs can reduce polyp formation and therefore reduce the cancer. But there are other studies that have not confirmed this. So therefore, it's very difficult for us to recommend this as a treatment or as a preventative measure. With regards to secondary prevention, this is preventing the disease at the polyp stage, that is, before the polyp grows and turns into cancer. The way this is done is by removing the polyp, usually during endoscopic examination, either by a colonoscopy, which allows us to look at the whole of the bowel, or a flexible sigmoidoscopy, which is an examination of the lower third of the bowel. And the reason why sometimes we do flexible sigmoidoscopy is because 70% of polyps and cancers arise in this part of the bowel. So it is seen as a reasonable way of preventing the disease. We are fortunate in the UK that we've got excellent screening programs which are dedicated and focused on secondary prevention. Well, first let's define what screening means. So screening is the process of detecting disease that is too early to cause symptoms in healthy unsuspecting individuals who have no risk factors other than getting on in life, in other words, getting older. There are two excellent screening programs in the UK. The first is the fecal occult blood screening program, which was introduced about 12 or so years ago. This program relies on testing stools for blood using the fecal occult blood test. If the test is positive, patients are invited to have a colonoscopy examination. If the test is negative, the test is repeated every 2 years. The program targets patients between the age of 61 and 75. Those who are above 75 can opt to take part in the program by request. So as soon as you turn 61, you will find a birthday present delivered to your door, which is the invitation to take part in the screening program. Now, it is important to know that if the test is positive, it doesn't mean that you have cancer, but you must have a colonoscopy examination to make sure that there is nothing there. And if the test is negative and you develop symptoms in the months afterwards, you must not ignore letting your doctor know about these symptoms, because sometimes the test can miss cancers. The second screening program is called the Bowel Scope screening program, which was introduced a few years ago. So the Bowel Scope involves carrying out a one-off flexible sigmoidoscopy examination at the age of 55, which allows visualization of the lower third of the bowel. If it shows polyps, then you are invited for a colonoscopy to have the polyp removed and the rest of the bowel examined. Now, it is important to say that screening saves lives, and it is absolutely important that you do not ignore the invitation for screening.